As we just told you, the Union Health Minister Mansukh Mandavia had held a meeting yesterday with the Indian Medical Association, and it seems the biggest takeaway from that was that Mandavia was urged to allow people to take their second coronavirus booster doses. The meeting took place over a video conference, and remember, it was called to discuss the preparedness of any possible surges in the outbreak. That was the biggest outtake from the meeting. Now, I do want to tell you about more uptakes. We'll also have my colleague join us with more details in just a second. As she does, this is Shireen. She's with us live from the Safdarjung Hospital, where Mansukh Mandavia, the Health Minister, will be visiting very shortly. Let's go over to Shireen to understand more. Shireen, can you tell us about the outtakes from the meeting that Mandavia had yesterday with the Indian Medical Association?
Well, there were about over 100 representatives from the IMA from across the country. In this particular meeting, Mansukh Mandavia has in fact told all these doctors that they should be the point person. They have always been the brave who have in fact stood in the front. They have been the frontline workers. They are the ones who have continuously worked during the first and the second wave. And now, in case the situation goes out of hand, they are supposed to continue with their work, is what Mansukh Mandavia has told them. Very specifically, he also told them that there is in fact a need to spread out authentic information, and people should not put out fake information, and the doctors should be the ones who should burst the myth or burst these fake news that is in fact coming out. So that is the kind of responsibility that has in fact been given to the doctors in this particular meeting. Also, they have been told that in their own areas, in their own district, they should in fact keep a check how well the hospitals nearby are equipped, how well the health facilities are equipped. Now, for the same reason, today there is in fact a mock drill that is happening across the country, is what Union Health Minister had told all these state ministers, health ministers, that they have to conduct one. If I ask my camera person to pan and show you, this is the Safdarjung Hospital where the mock drill will in fact take place, and the 9 points on which the mock drill is going to be looked into. One is the geographical availability of the healthcare centers and hospitals. How near are they in particular districts? Secondly, the isolation beds, the ICU beds with ventilators, the referral point resources, the COVID management, we have seen doctors, nurses, what is their availability. So the kind of preparation that is happening over here, if we enter this particular Sari ward, you can see there are in fact a number of beds that are here, the ICU beds which are in fact put over here, and this is where, so overall the mock drill is going to be in a way that they are going to pretend that a person has come to the hospital, he or she will be tested, and in case the person is COVID positive, the person will be isolated depending on the nature of the infection, how strong the infection is, whether the patient is asymptomatic or symptomatic, and what is the oxygen level. Depending on all that, the patient will be in fact admitted in the ICU ward or the ventilator ward. If I ask my camera person to come, this is in fact the triage area, which is the cleaning area, which is where the testing will be done. The patient will be coming here, the doffing area where the patient will be tested, and accordingly whatever the symptoms the patient have, they will be shifted to the isolation bed or in fact to the ICU ward or ventilator, depending on what is the level of the nature of the infection that the person has, whether the person is asymptomatic or symptomatic. I have with me doctor over here. Sir, is everything ready now?
Yes, everything is ready.
All right. And what is the kind of, if you could tell our viewers, what is the kind of readiness that the hospital is prepared with?
Actually, we have now segregated the whole area of COVID. Now it has got 28 beds here and 16 beds here. So we have enough number of beds, and if any patients who comes with the ambulance either, so we can have a triage area. We have made it a triage area, and the doctor will sit here, he will assess the patient, take the records, and then the investigation throat swab or nasal swab will be done there. And the patient can wait for 15-20 minutes. We have the RAT kit. The report can come in 15 to 20 minutes. If the report is positive, he is taken as positive. If the report is negative, we can do a TrueNet also. That has a better sensitivity.
What
So-
is TrueNet exactly?
TrueNet is also a type of detection of virus. There are 3 types of tests. Na? One is your rapid antigen test, one is your TrueNet, and one is your RT-PCR. RT-PCR is done in the microbiology lab. TrueNet is a on-the-spot
And
test.
how much time does it take for
TrueNet will take 1 hour.
One
So we will 1 hour. In 1 hour, we can decide whether the patient is really having COVID or not non-COVID.
Also, during the second wave, oxygen was something that was in fact a big.
We have now a PSA plant. Na? There is no problem
so how
of
far
oxygen.
is the PSA plant?
This near, just behind the ward.
All right. So for the same reason is what this mock drill is happening, for proper checking of how well equipped each of the hospitals across the country is in case the situation goes out of hand. At the moment, we are seeing that the case load in India is in fact below 200. Yesterday it was around 175, and today we have to of course see what are the numbers, but the positivity rate is also low. But that is not a situation where the government can in fact relax. They want to be very vigilant, and that is why they don't want to leave any stone unturned to ensure that the country is well prepared as far as the COVID equipments and facilities in the country is concerned.
Okay, Shireen, when it comes to the booster shot, I want to understand from you. You were sharing with us just a few days ago that the most recent data shows that only about 30% of those eligible have actually gotten it. I want to understand from you, in the news in the last few days that there's been a surge in China. Have we seen a change in those numbers? Have more people opted to get the booster shot? That's question 1. And question 2, will we see a renewed campaign from the government towards that, encouraging that?
Well, I'll just take out the data from 22nd because we had in fact put out the data of 22nd December. We have shown how since 18 December there is in fact a dramatical rise. From 4,000 we have seen how 57,000 people have got inoculated themselves on 22nd December. Now if we take the COVID data on 23rd December, the precaution dose, in fact people around 77,000, over 77,000 people have in fact inoculated themselves. This continues on in fact 26th December as well. 25th probably because of the Christmas day there was in fact a dip. There was only 22,000 people who got themselves inoculated, but it in fact continues on 26th December as well. Yesterday as well, in 24 hours over 71,000 people have got inoculated. So the increase in the pace of the precaution dose is in fact only continuing. There are more and more appeals that are being made by the government, and like you said, yes, there are in fact a number of plans and programs that the government has in mind, because we have seen for past few months altogether the precaution dose remained very low, especially for the category between 80 years and above, though the elderly were covered, but it remained very low, and that is why the government is making several attempts. There could in fact be a number of programs that the government will plan, because if you remember during after the second wave, for the second dose as well, we have seen how the government were planning a number of initiatives. They were planning how from each district the representatives will bring in more and more people to get themselves inoculated. So a similar program can be seen in coming days, because the government wants that the precaution dose should in fact reach the comfort level, the level where a large number of population gets covered in under the precaution dose.
Okay, Shireen, thank you for bringing us those